Welcome to Face the State. I'm Ariana Bennett. Thank you for being with us. Well, roughly a quarter of the adult population in the United States currently experiences a mental illness, with between 7 and 9% suffering from depression. Now, that's according to data from the Centers for Disease Control, which places Nevada on the higher end of that spectrum. So, how do you know when to seek help for yourself or for a loved one? Dr. Phil Molinas is here now to discuss that with us. Thank you so much for coming on the show.
Thank you for having me.
I so appreciate your time. Okay, so if it's either temporary or a long-term mental health issue, it's so much more common than I think most people realize. But because of that stigma, do you think a lot of people are not seeking treatment?
Oh, absolutely. I mean, that's the problem. People feel that somehow they've failed or there's something wrong with having a mental illness or a problem, and so they try to wait it out or get through it, and often they get advice to just buck up and get through it. But if it starts to interfere with their life, there's treatment, there's help out there.
Do you find that most people who come to you don't realize that what they have is a mental illness, that they think it's just a temporary passing thing, or just it's a bad time in their lives?
Well, as a psychiatrist, no. By the time they get to me, they maybe had some help, most people, or they have a pretty good idea they need to see a psychiatrist. But I think a lot of people maybe go to their primary care physician or just ask for advice from friends or family or people that counsel them, not knowing what it is. And maybe at that point, it'd be good if they get some good advice on how to find out more about what's wrong with them and get the proper help.
If you could estimate, I mean, is it a big number of people who are kind of being lost in other parts of the system and not getting the type of help that they need?
Oh, certainly. So we know that a large percentage of people don't get the right help they need or help at all for many years, even, who have severe illnesses. And then when you think about people who just have mild or temporary problems, yeah, they may never get help. Fortunately, some of them just get better on their own. Things do pass, but there's a lot of suffering out there of people that could be helped.
Right. What are the most common issues that you see?
Well, again, as a psychiatrist, as a specialist, I'm going to see the more severe things: bipolar disorder, major depression, people who are hearing things and seeing things, and severe anxiety, severe panic attacks. But again, there's lots of mental illness that's milder, that still can be helped, that there's no reason for people to suffer. They may not even need to see a psychiatrist, but there's a lot of milder forms of anxiety, depression, anger issues, substance abuse, interpersonal problems, problems that couples have, that all can be helped.
And for a long time, and I think to some extent still now, a lot of those things were classified as this separate issue that isn't part of physical health. A separate problem that people don't talk about. It's not the same thing as like breaking a leg, where although you obviously need to see a doctor, it's nothing to be ashamed of. Especially with anxiety and depression, where I think maybe for many people there's a fine line between the amount of stress and anxiety or sadness that we expect to feel and how much is too much. So how do you know?
Well, again, I think functional impairment would be the formal term. When it starts to interfere with your life. So, everybody gets sad, everybody gets somewhat depressed, or things make us anxious. That's just part of being human. But if you're so anxious that you can't get out the door of your home, you can't, to go to school, to go to work, you're so depressed, you're not eating or sleeping, it's starting to interfere with your life. Again, with the mild things, people say, or people, we're all raised to think, well, be strong and be self-reliant, be independent. But again, if it gets bad enough, it interferes with your life. Just like a broken leg, you can't walk on it. Absolutely.
So it obviously can affect anyone at any stage of life, right? Does this happen in children as well?
Yes. So I see children as well as adults, and have treated children for almost all the same illnesses that adults get. Not as common, fortunately, but it happens.
I imagine is it a little harder to tell with kids? I mean, they already are experiencing so much and changing so much that, behavioral changes are to be expected somewhat. in
Certainly,
childhood.
and you have to take that into account. You have to, throughout the life cycle, you have to evaluate a patient based on what's normal for their age, for what they're going through in their life. There are things that the elderly go through, that young adults go through, that children go through. And you have to, with experience, know what's normal, what's to be expected, and sometimes you're not even sure, and you help them for a while, and over time, most problems become pretty clear.
So what should a parent look for then if they're thinking, well, is this normal behavior?
Well, again, like I said, with time, time will tell. So if they, you can wait a little bit. Again, depends on the amount of how bad the problem is. And the people for a parent, schools, teachers, they've got a pretty good sense of what's in the normal range for kids, because they see lots and lots of kids over the years, versus what's becoming out of the normal range. So I think they're a great resource for helping you figure out what needs more help.
Okay. Now, mental health, of course, linked to lots of other things, linked to other types of health conditions, cancer, obesity, diabetes, all that sorts of stuff. Do you find that treating one kind of helps treat the other? Are these things kind of interconnected?
Oh, absolutely. So we know that stress is going to affect the physical health, the immune system, the immune system, so that being stressed makes you more prone to getting other illnesses, hopefully milder things, or making pre-existing conditions, blood pressure, blood sugar, get worse. So treating the person's mental health helps that. We also know certain mental illnesses are risk factors for other physical illnesses. Cardiovascular illnesses would be the most common.
Really?
So again, treating mental health is an important component of your overall health.
So is it people who are more prone to having mental illnesses are more prone to having cardiac issues, or is it?
There are some correlations like that, yes.
Huh, interesting. It's a fascinating thing, I think, that it's such the mind-body, connection. Nothing is separate.
That's right.
Right. Okay, so there are some specific types of, like subsets of depression and subsets of anxiety disorders that I think are interesting to take a look at. So, for example, postpartum depression, a lot more common, once again, than I think people realize. I think I read that it's like 10 to 23% of new mothers experience.
Yeah, so like we were talking about life events and how do you tell what's normal versus becoming illness, and that's a good example. It's a stressful time. Of course, there's large hormonal fluctuations. So, we would expect some stress, anxiety, maybe depression postpartum. And so it's a time we watch out for. And of course, in my patients that already have depression, women who already have depression, who then get pregnant, then we're watching very carefully, especially if during the pregnancy we're going to take them off of medication or reduce it greatly for the safety of the baby right after the delivery. Of course, we're watching out for postpartum depression.
What do you look
treating
for?
it quickly.
How do you tell the difference between just an exhausted, overwhelmed new mother and a mother who might have postpartum depression?
Well, again, it's that how they're functioning. Are they still doing what they need to do? Getting up at night with the baby, taking good care of the baby, leaving the house, interacting with people, staying in contact with their family and friends. Or are they withdrawing? Are they, and if they're talking to you, are they getting very depressive thoughts and, that's getting out of that normal range and could be helped by treatment.
Okay. What about post-traumatic stress disorder? I know this has become a lot more commonly talked about since a lot more military activity, but you can get it not just from serving overseas. People can get it from car accidents, that sort of thing.
Yeah, anything that's makes you fear you're going to die or you're going to have grievous bodily harm. It can be a severe enough trauma to give post-traumatic stress disorder.
Now, what are the symptoms of that? How do you know?
Well, so then what happens is so sometime later, so normally you're traumatized, you work through it. You maybe have some nightmares about it, anxiety, flashbacks to it, but it goes away. But if sometime later these things come back, you get flashbacks, like you feel like it's happening again, or you're there in that situation again, or you get nightmares about it, or you can't go certain places or do certain things because it reminds you too much of it, it's too anxiety provoking. That's post-traumatic stress disorder. And that's a good example of something that people think, oh, I should just be strong, I should just forget about it, or they might even get that kind of advice, put it behind you, but you can't stuff it. You've got to work through it. You've got to deal with it in some way so it doesn't continue to torture you.
Because this stuff is treatable, and there are a lot of different options for treating it, right?
Right. So post-traumatic stress disorder would be a good example where psychotherapy, we're having a therapist that you talk to, that you talk through the problem, or maybe you use a specific technique like something called EMDR to work through the trauma, allows you to process it, to get through it so that you don't continue to have those symptoms of it still bothering you.
Now, are a lot of treatments for these types of mental illnesses pharmaceutical also?
Well, yeah, and again, I'm a psychiatrist, so I certainly use medications to help most of my patients. And depending on the illness, medication may be primary or it may be adjunctive, helpful, but not the main focus. So post-traumatic stress disorder, if we're using that example, the main thing is you have to work through the trauma so that it doesn't continue to eat at you. But there are medications that we use to help people be less anxious, to help people to block the nightmares of post-traumatic stress disorder, to be less depressed about it, to get through it. And that can often help them then to do the therapy work they need to do to deal with the original trauma.
Right. So that's not necessarily seen as it's not a long-term permanent pharmaceutical routine. It's just temporary.
Exactly. Where something like bipolar disorder, which in adults is a lifelong illness, you want to get on a medicine that's going to keep your mood stable, keep it from swinging up and down severely. And when you get on that, then you just stay on it and you keep your mood stable so you have a regular life.
Okay. Now, for people who maybe have anxiety or depression, some of the more common iterations of mental illness, who maybe don't want to go the pharmaceutical route, are there other recommendations?
Again, it depends on the disorder. So I mean, therapy is helpful in almost all disorders and can go a long way towards helping a person deal with it, improve their functioning, like I've talked about. But certain things aren't going to may not get better with this therapy alone. So bipolar disorder, therapy is not going to keep the mood stable. Severe illness like schizophrenia or an illness that causes a person to hear things or be paranoid, therapy can be very helpful, but there's medications to really get rid of those more severe symptoms. Depression, if it's bad enough, depression will, in most people, eventually go away, but of course there's risks of having suicidal thoughts and maybe killing yourself and before it goes away, where we have medications to get it better a lot quicker and help people feel a lot better quickly and be much safer.
For the less extreme cases, what about something like meditation? Is that helpful?
Certainly for anxiety, for various anxiety illnesses, conditions, very helpful.
Okay. All right, I think that's a perfect chance for us to take a quick break, but coming up on Face the State, I will be back with Dr. Molinas for a closer look at how mental illness can become dangerous. Stay with us.